Okay guys, I'm going to talk about antidepressants in this video, but I want you to know that in the United States in 2021, there were about 21 million US adults that experienced at least one major depressive episode, and the market size of antidepressants is rising. It was estimated to reach around $20 billion in 2024. So let's talk about the medications. Let's talk about the second generation medications for antidepressants. Here we have bupropion, trazodone, amlodipine, maprotilene. For bupropion, the drug has this kind of side effects like dizziness, tremor, sweating, aggravation of psychosis, and potential for seizures at higher doses. For trazodone, it has a sedative action, and the side effect with this drug is that we have this nausea, insomnia, dizziness, agitation, drowsiness. For amlodipine, it is a metabolite of a particular antipsychotic drug called clozapine, and it is particularly suitable for depression in psychotic patients. The side effects of amlodipine are Parkinsonism, acacia, amenorrhea, galactorrhea. Let's talk about the last drug here, the maprotilines. They look like desipramine. They have a potent non-adrenaline uptake inhibition, and this fewer sedative and antimuscarinic action than older tricyclic antidepressants. And also, they develop seizures when used at a higher dose. Let's talk about the third generation antidepressants, which are venlafaxine, mirtazapine, nifazodone. So, for venlafaxine, it has this strong inhibition of serotonin reuptake and a weaker inhibition for noradrenaline. The side effects with venlafaxine are anxiety, hypertension, sexual disturbance, dizziness, sweating, somnolence, nausea. For mirtazapine, it has this sedation action, and the side effects with this drug are weight gain, dizziness, increased appetite, somnolence. For nifazodone, they are related to trazodone, but they are less sedating. And the side effects with nifazodone are nausea, agitation, insomnia, dizziness, and drowsiness. Guys, let's talk about the monoamine oxidase inhibitors, whereby we have phenelzine, triacylcypromine, selegiline, meclobemide. Let's talk about phenelzine. Phenelzine is a kind of hydrazine compound that has this CNN moiety, and the drug effect with phenelzine lasts for 2 to 3 weeks, compared with phenylcypromine, which is a non-hydrazine compound that resembles dextroamphetamine that only lasts for 7 days. We have the meclobemide, which is a reversible short-acting monoamine oxidase inhibitor that has no interaction with tyramine metabolism, so that's the advantage with meclobemide. And the selegiline, which is a selective monoamine oxidase B inhibitor that is used to treat Parkinson's disease. So, for the monoamine oxidase inhibitors, the pharmacokinetic is that they are readily absorbed from the GIT, from the GI tract, gastrointestinal tract. And the side effects with monoamine oxidase inhibitor is that they have this weight gain, sleep disturbance, postural hypotension, sexual disturbance, toxic serotonin syndrome, which comprises of shock, seizure, delirium, agitation, hypothermia. And the indication for the use of monoamine oxidase inhibitor is that it is used for atypical depression, whereby you have these phobic features, attendant anxiety, hypochondriasis. Guys, let's move on and talk about the fourth generation antidepressant, which are the SSRIs, the selective serotonin reuptake inhibitors, which are the most widely used antidepressant in the world today. And they have no sedative or antimuscarinic action, unlike the tricyclic antidepressant. And the indication for use of these SSRIs is that they are effective in panic disorders, and the mechanism of action of this drug is that it blocks the amine pump for 5-HT, which are serotonin pumps. The side effect with SSRIs is sexual disturbance, decreased libido, anxiety, insomnia, tremor, nausea, gastrointestinal symptoms, which is for sure something you should take note of. So for the drugs, in this class, we have the fluoxetine, which lasts very long. It has a long half-life of 7 to 9 days compared to the rest of the drugs here. However, we have this citalopram and fluvoxamine, and we have sertraline, which has shorter half-life, and paroxetine also have a shorter half-life. Guys, let's move on and talk about the tricyclic antidepressants. They have sedative action, they have antimuscarinic action, they resemble phenothiazine chemically and to a lesser extent pharmacologically. The mechanism of action of tricyclic antidepressants is that they block noradrenaline and serotonin reuptake inhibitors. The indication for use of tricyclic antidepressants is that they are used for treating chronically painful states. And their pharmacokinetics is that most tricyclic antidepressants are incompletely absorbed and they undergo significant first-pass metabolism in the liver. So take note of that. So let's move on and talk about the side effects with the use of tricyclic antidepressant. They have sedative action. They have sympathomimetic action like insomnia and tremor. They have the CNS effect like seizures. They have psychiatric effects like aggravation of psychosis and withdrawal syndromes. They have cardiovascular effect like arrhythmias, orthostatic hypotension, conduction effect. They have antimuscarinic action like dry mouth, urinary hesitancy, constipation, blood vision. They have metabolic endocrine effects like weight gain and loss of libido. So you can see why they are not the first line drugs for treating depression. Example of drugs in this class are dozapine, amitriptyline. The last but not the least, let's talk about atormozapine, because it is used to treat ADHD, which is very prevalent in the United States. So take note of that. And we have the SSRIs and clomipramine, which are both useful in the effective treatment of obsessive compulsive disorder, which are also called OCD. So bye for now.